The drug that I have chosen to do my new drug paper and presentation over is the drug Enhertu. It is spelled Enhertu. It is a drug that is used to treat breast cancer. Enhertu is a HER2 directed antibody and the topoisomerase inhibitor conjugate indicated for treatment in adult patients with unresectable or metastatic HER2 positive breast cancer who have received 2 or more prior anti-HER2 based regimens in the metastatic setting. This indication is approved under accelerated approval based on tumor response rate and duration of the response. The action that Enhertu undergoes, it's a HER2 directed antibody drug conjugate. The antibody is humanized to the anti-HER2 IgG1. The small molecule DXd is a topoisomerase 1 inhibitor, attaches to the antibody by a cleavable linker. Then following binding to HER2 on the tumor cells, the Enhertu undergoes internalization and intracellular linker cleavage by lysosomal enzymes. Upon release, the membrane-permeable DXd causes DNA damage and apoptotic cell death. Recommended dosage for Enhertu is a 5.4 milligram per kilogram given as an intravenous infusion every 3 weeks, which is undergone on a 21-day cycle until the disease progression or unacceptable toxicity. The first infusion will administer over 90 minutes. The subsequent infusions after the first infusion will administer over 30 minutes if prior infusions were well tolerated. Slow or interrupt the infusion rate of Enhertu treatment if the patient develops infusion-related symptoms, and permanently discontinue Enhertu in case of severe infusion reactions. If any dose modifications is needed to the treatment of Enhertu, the first reduction will go from a 5.4 milligram per kilogram down to a 4.4 milligram per kilogram. And then if even further reduction is needed, the second dose reduction will go down to a 3.2 milligram per kilogram. If any other reduction is needed past the 3.2 milligram per kilogram, it will just have to discontinue the treatment permanently. Some serious side effects when taking Enhertu that the healthcare provider will need to know from the patient: any lung problems, any cough, fever, shortness of breath, cough, wheezing, tight chest tightness, low white blood cell count. It is common when taking this treatment, but it can be severe with this drug. The healthcare provider will then determine if the treatment needs to be stopped or reduced, as said in the dose modifications, if it needs to be reduced, or if any of these side effects are too severe that it needs to completely and permanently stop the treatment of Enhertu. In the pediatric regimen, the safety and effectiveness of Enhertu has not been established yet in any of the pediatric patients. There has not been any record taken on pediatric patients. They have not done any approval on pediatric patients, so it is just safe to say that there's no effectiveness. It has not been established on any pediatric patients yet. Pregnancy while taking Enhertu, the mechanism action as described earlier of Enhertu can cause fetal harm. So the patients need to let the healthcare provider know if they are pregnant, if they're wanting to be pregnant, because this can cause fetal harm. because of the mechanism action described earlier. And that was my drug, some information on my drug, Enhertu.